You know what, Amethyst, I think you have to shut your camera off after you do the introduction.
Okay, everyone is in now. Okay, good evening and welcome to the Tourette Association of America's Zoom and Facebook Live webinar. Tonight's topic is supporting your child's transition to back to school post-pandemic. These slides were developed by Patty Mendoza, a school psychologist and also a member of our TAA Education Advisory Board. Due to unforeseen circumstances, Patty was unable to join us tonight, so our Tourette Association of America Education Specialist, Wendy Wegman, will be presenting on her behalf. Wendy was a teacher for over 20 years and also has a son with Tourette syndrome. Wendy, please take it away.
Thank you, Amethyst. Thank you, everybody, for being here. I really appreciate you. Those who have joined us here on the Zoom tonight, we're also live on Facebook. We all know that this is a difficult year for a lot of people getting back. Children and teens are experiencing different emotions. It might be excitement to see their friends again, which is normal for every school year. Just some of the children and teens that go to school haven't been around their friends the same amount of time, 5 days a week, as normally they would have last year. So this is a big transition year for most students. And with that in mind, I want you to know that Patty Mendoza developed these slides. Like Amethyst said, she's a school psychologist, and I'm presenting her material here. As a school psychologist in California, these are her suggestions for supporting your child with Tourette syndrome's transition back to school. My slides are not going forward. There we go. So the first thing that Patty wanted to talk about is coping strategies. And as I mentioned, it is a difficult transition year for a lot of students, and as a lot of you know, stress is at an all-time high right now for children and teens, and anxiety and depression are also, very much on the rise. I'll add to that, OCD symptoms are also on the rise right now. And we know when anxiety and stress are on the rise, tics are also on the rise. So be mindful that some of these symptoms that your child is experiencing may come across in different ways. Like I said, it might be excitement, but it also might be emotions manifesting themselves in frustration or maybe some anger. So be patient and realize that this is what is going on at the beginning of this particular school year. It's important really to establish healthy coping skills to reduce stress, not just for the child, but also for you. So making a coping skills toolbox with your child at home and school. On the next slide, we're going to talk about some tools that could be in your toolbox as you enter this new school year for your child, but really for you too. It isn't easy on parents to start a new school year, and it isn't easy to manage the stress of children with Tourette and co-occurring conditions as they go back into a school year that we know as well that there is a Delta variant out there, and some of the stress around wearing masks and not wearing masks and being in closer proximity to people in close spaces is also contributing. So find strategies that work best for your child. It's going to depend on age. It's going to depend on your child. I'm going to go over some of these strategies, but like I said, these are strategies that as a parent, you can also use. So things like mindfulness. Mindfulness is really just being in the moment. And sometimes even for when my children are feeling distressed, I have a son with Tourette syndrome, like Amethyst said. I also have a teenage daughter. And sometimes when they're feeling really distressed, I will say, they might say, everything isn't okay. It's not going to be okay. And I'll say, it is okay right now. Your feet are on the floor. Right now, you're standing here in the kitchen. You have a glass of water. And it's just really bringing the mind to the present moment. There's a lot of apps that you can use to help with this. Insight Timer is one of those apps. It is free, actually, and Calm has a free basic kind of access to their library of mindfulness and meditation. You can also model positive self-talk. So by talking out loud, things that you say to yourself and teaching your child some positive self-talk, such as "I've got this," "I can do hard things" is a big one these days. Deep breathing. So there's different ways to practice deep breathing. Deep breathing is feeling your breath going into your abdomen and up through your lungs. A lot of times it's counting to 4. I like to make a square: in for 4, hold for 4, out for 4. For younger children, a count of 2 or 3 might be appropriate. Practicing self-compassion. You can do this, and you can also model this for your child. I really messed that up today, but you know what? I did my best. I'm gonna treat myself to a nice walk. I'm gonna treat myself to a nice dinner with you. Showing ways to be compassionate with yourself, and will help your child to understand how to do that too. Mental health professionals are available at schools. I do know across the country that funding has been up at many schools for mental health support. So take advantage of that if your child needs that at school. And also, there are services available outside of school, and it's important to use those when needed. Post-its with positive affirmations. I've done this for my kids and put them right on the mirror in their bedroom or bathroom. And then my daughter has actually started to do this for herself. Inspiring quotes to read daily. I personally love quotes, and you can even get apps that have quotes for you or your child, and a lot of those are free too. Expressing your feelings. Getting out in nature just for a walk outside. Gratitude, writing down 3 things that you're thankful every day in a journal, having your child practice this. Negative thoughts, writing them down and throwing them away or tearing them apart. Exercising is really important. Meditation, again, those apps are good for that. If your child isn't interested in meditation, but you use it for your own self-calming and they see you doing this, you're modeling a calming technique for them, and that is another way to teach them, how to do this. It's really important. You might not think that they'll pick up on that, but they will. They'll pick up on the coping strategies that you use. Journaling about your emotions. Wonderful. Make sure your kids have journals if that's something that they'll use, or they can even use their a Word document, a folder, just for their own journal if they prefer to type. Taking breaks, for sure. When you feel stressed and it's too much to talk about it in the moment, or the moment is too difficult, always feel free to take breaks, and make sure that you make that something that your child can also know when to do. And it carries over to school as well. All of these techniques do. Be mindful of your attitude and approach to life. Sometimes we all have to realize that we're caught up in a negative situation and our kids can overhear us. So it doesn't mean that we don't need to vent sometime, but oftentimes it's important to push the reset button, and that'll help our kids move forward as well. Whenever you need or your child needs a helpline, there's many helplines available, and always make sure that you're in tune to that as a resource as well. Using school resources to help your child. So, understanding that the school resources could play a really crucial role in the re-entry to school for your child. So don't be afraid to reach out ahead of time to the school, and let the school know if your child is experiencing symptoms of anxiety, OCD, more pronounced tics, especially depression. Be sure to reach out ahead. Like I said, a school counselor can help come up with a plan to put in place, and many schools and districts right now do have that extra support. You can request a child study team with the school team, or I'm sorry, a child study meeting with the school team. You can request a meeting to review your child's IEP accommodations and services. Same thing with the 504 plan. You can do all of this when school starts, or if you're not able to get a meeting right when school starts, sometimes it actually works out to have that meeting in September or October if that's what they can get on the calendar. Sometimes the schools are able to put some extra supports in place and have that meeting a little bit later, and it gives you the opportunity then to see how what's in place is going for the child, how it's going for the child, and be able to tweak things a little bit if that's what's needed. You can request, and I'll talk more about this in another slide, a functional behavior assessment. It's called an FBA if your child is having difficulty managing behaviors. You can also request a behavior intervention plan for your child for the same reason. I will also share in another slide what's called fast facts for the teacher, and that is a way to have information available for the teacher that is a quick reference. And, we want all of our educators to be aware of IEP and 504 plans, but it's a way to draw attention to what's most important in those plans, or if your child doesn't have one, what's most important for your child. So IEP and 504 accommodation ideas. These are accommodation ideas for tics. Certainly there are accommodations for children's anxiety and OCD symptoms, but I'm going to go over these accommodations for tics. So you need to allow access to the nurse's office when the tics cause headaches. And you especially this year need to make sure you let the nurse's office know, as well as the teachers know, but especially the nurse, if tics do cause headaches, if maybe anxiety is causing headaches right now or stomach aches, because with COVID, you're going to get a phone call and your child's going to be sent home every time. But I know this from experience, even last year with my own son, that the school nurse was aware of some symptoms that he would have due more to anxiety. And she would examine and then let me know that he came down and be able to send him back to class, knowing that it wasn't, something that he needed to be sent home for. We're on more high alert at that right now, of course. Ignoring tics and asking peers to do the same. So if your child's tics are visible in school, be sure to include any kind of peer education. It doesn't have to be elaborate, but certainly we can help with that. Here at the Tourette Association, we have youth ambassadors who can help educate other classmates. You can reach out to us at support@tourette.org if that's something you're interested in. But really what the main thing is trying not to react to the tics. So letting educators know that, letting peers know that, and having that be part of an IEP or 504 accommodation, written in there. Permission to leave the class if necessary for tic reduction. And that could also be for anxiety if that's necessary. And these are accommodations that not everybody needs. I just want to make that clear that these are, kind of a salad bar of accommodations, if you would, that you can choose from what would fit for your child. Your child might want to be seated in a location that diminishes the noticeability of the tics, and that might be an accommodation on the plan. There might be an accommodation on the plan to make sure that the school, the teachers communicate with the family if the child isn't completing assignments or falling behind academically. And to have that right on the 504 plan or the IEP plan, if that's ever been a concern or could be a concern for your child, is really important, so that those incomplete homework assignments or lower grades don't drag out to the point where it's really difficult to catch up. Allow for extended time to complete assignments is a great accommodation. Sometimes kids like to have tests, take their tests in other locations. So that is sometimes an accommodation that you can put as a choice. It should be on the IEP or 504 that all staff working with the child should be informed of her tics or his tics, and access to something that could reduce tics or anxiety during test time. So it might be lollipops or Jolly Ranchers. I know I've used Tic Tacs or mints that, those sometimes are preferable. Other 504 or IEP accommodation ideas are for, these are actually particular to distance education. So we don't know with the Delta variant if students are going to need to go back to home learning for a short period of time. I know it's not what we all want to hear. I do know that there are some schools in the country starting virtually this year again. So, some of the accommodations just to be aware of are copy of materials presented virtually when necessary, ignoring tics, and asking peers to do the same when they're on a Zoom or a Teams meeting or whatever the platform is that the school uses. You want to, again, try not to react to the tics and have that in as accommodation for sure. This was a big one when home learning started. Teachers wanted the cameras on and were pretty adamant about that. And, it's understandable. Being a teacher can be really difficult when you're teaching to a blank screen, or you're teaching to, blank cameras off, you can't even see the faces. But there are definitely occasions where children and teens with Tourette need to have their cameras off due to their high frequency tics. Some requested off due to high anxiety as well. So make it clear if that is something that your child needs, and that should be able to be put in place as an accommodation. Communicating with the parents if they're not completing assignments, just like I said, if they're at school, some of these accommodations transfer right over, like the extended time, and informing everyone about the tics. I want to mention that I'm glad Patty put in these distance education accommodations as well, because if there is, potential for exposure to COVID, it might not be, the school is closing down, but it might be that your child needs to stay home for a period of time and learn from home for those kinds of reasons as well. I did say I would get to functional behavioral assessments. So this is the information on what those are and how to request one for your child. It's understood to be an evaluation under the Individuals with Disabilities Act. That's IDEA. That's the federal education law. And the term means functional behavioral assessment really is a process of determining the cause or the function of a behavior before you develop an intervention plan. So the intervention must be based on the hypothesis, cause, or function of the behavior. So that's the way it's written into the law. And the functional behavioral assessment procedure, it actually has 3 components that the school needs to follow. There's an interview with a person who works directly with the student. So that person interviews the student. Observations that examine the environmental events surrounding the behavior. And then the last part of this, I can't see her slide because of my little bar here, is an observation that estimates the current frequency of the behaviors. So this really takes place over a period of time. It's not usually a quick observation, just so you know. It's usually pretty involved, and it can be effective in helping identify, that function of the behavior. So I think that I'm trying to see if there's any other notes that I have on here that I want to tell you. Oh, this is important. FBAs can be done with regular education students and general education students. Your child does not have to have a 504 or an IEP to receive an FBA or to have an FBA evaluation. And you can request this evaluation from the school psychologist or from the behavioral intervention team at school. Let's see, next here, Behavior intervention plans, often referred to as BIPs or BIPs, and they help define the problem behavior. And they kind of ask the question as what is the hypothesized reason why the behavior occurs. It looks like we're missing some information on the first bullet, but there might be reasons why the behavior occurs. And I think about when I think about kids with Tourette, sometimes it's not a tic, but it's an inability to filter for other reasons. It might be the child might be disinhibited due to sensory overload, or due to their OCD, or due to heightened anxiety or their ADHD. They might be avoidant of something due to perfectionist tendencies, due to a fear. They might be avoiding schoolwork. So what is the reason behind the behavior? And what BIPs do, or BIPs, behavior intervention plans, do is they look to finding a replacement behavior. They look at reinforcement procedures, and they do involve data collection. It is important to know that it really is tricky with kids with Tourette, because you're not sure if the behavior is a tic or something the child can control. I think that's important, where asking the child is important, and listening for the team to listen to the family is also important. So when those behaviors occur, just make sure that's taken into consideration. And tic frequency should never be a goal. So it should never be a goal to reduce tic frequency or anything like that when it comes to BIPs or FBAs. So this is a slide on how school psychologists can help support your child with CBT, this cognitive behavioral therapy. Also, a school social worker or a school counselor may be able to support with this as well. But definitely school psychologists are usually very knowledgeable about CBT. And CBT looks at thoughts and the effect of our thoughts. What we think affects how we feel and act. So is there a way to possibly change some of those thoughts, to reduce some of the anxiety, some of the more depressive thoughts? And then the behaviors, what we do affects how we think and act, right? How we think and feel, rather. And our emotions affect how we think and act as well. So it's really about awareness of those emotions. I wanted to note what Patty notes here, that this is a form of psychological treatment, and it's definitely demonstrated to be effective for a range of problems, including anxiety, depression, eating disorders, and severe mental illness. It's demonstrated to be as effective or more effective than other psychological forms of therapy or psychiatric medications. And it is the most evidence-based practice. And the kind of theory behind CBT is that if you can think differently, you'll be able to feel differently. So then you'll be able to behave differently, which is this circle that's on the slide right here. And your brain believes what you tell it. So Patty says that she tells the kids to be brain detectives, which thoughts are true and which thoughts aren't. So I do know that there are also therapists outside of school that use cognitive behavioral therapy for children, and it can be effective. And when we're talking about going into this particular kind of a school year, and we're talking about, the anxiety that can be in place, it might be an effective therapy to investigate either at your school or with outside counseling. So the FAST fact sheet, I know Amethyst has put the slides into the chat for you. The FAST fact sheet there's a link right here to this, and it's a fabulous idea. Patty uses this, and I'm actually going to use this year for my son to give to teachers and school personnel. In the past, I've used a letter, but the fact sheet actually breaks, it's like one paper, like one sheet of paper, and it breaks that paper into 4 sections. And you'll see when you click on the link to it that the sections are getting to know, the name of your child, diagnosis and health issues, TS information, and then another section with suggested accommodations and supports. So Patty actually, if you click on this link, when you download the slides, Patty has examples right in there for every section. So it makes it really user-friendly and something that's really easy to pass on to teachers, counselors, administrators, anyone who's going to be working with your child. And I would even say if your child's riding a bus, you may not need as much information on it, but do something like this for the bus driver as well, to let the bus driver know about your child. They actually will really appreciate it. And then, last I want to talk about finding your support system. So finding your support system, really important. It's, we're all managing a lot right now. And even before COVID, when you have a child with Tourette syndrome and co-occurring conditions, you're always looking and managing for ways for school to be successful, for home life to be calm and successful. So finding your support system, find a local chapter or support group, a Tourette Association of America chapter or support group. This link here in the slides takes you right to our website, which by location will let you know if there's a chapter or support group near you, and you can reach out to see if there is some support available there. We also have online support groups here at the National Tourette Association of America. And this is where you can click to actually register for the support groups. They are on a rolling basis, so there are sometimes when the groups are already in session, a waiting list, but be sure to put your name on that, because as soon as something opens up, they'll reach out. We designed the online support groups for outreach to areas, to families in areas where there is not a chapter support group. So please, use that resource if you would like to. And then, Patty says support for both parent and child. And it's really important that she says to take care of each other, right? So taking care of yourself, like I mentioned when I talked about the toolbox, things for yourself, and as well as taking care of your child, because we can't take care of a child if we're not taken care of, right? And going into the school year and breathing and trying to be calm for our children as well, because we have worries too. There's been a lot of change, and your child may have changed in more ways. Their symptoms might be different for sure, and you may not have been aware of communicating those symptoms because you may not have been having to do it as much. I mean, even if your child was in a hybrid model last year, going a few days a week, there was some relief from being in school and wearing the mask the other 3 days during the week. So there may be symptoms that you saw that you didn't really necessarily need to communicate, and you may not be in that habit, but make sure you pay attention to that. Make sure you pay attention to the school plan and your child's symptoms, and you communicate what's going on. And then taking care of yourself, it's that putting your oxygen mask on first. If you're in a good place, you're going to be clear about what your child needs. And, certainly as a parent who has a child with Tourette, there are times when things come up that are unexpected. And we always have to kind of be prepared for that, right? For the things that life throws at us when our kids go back to school. So make sure that you're getting your rest and eating well and doing the things you need to do for you, so that you can be there for your child. I just wanted to thank you so much for attending this. It's not over because we will take time now to answer questions that are in the chat or in the comments on Facebook. And if you could just make sure those questions are in the chat, if you've been putting them in as you've been going, that's great. And if you have any others that you'd like to put in now, or as you hear questions and you hear me answer them, anytime you want to put them in, I'll answer them. Amethyst is going to read those off to me.
Okay, Wendy, the first question comes from Heather R. Is it possible for the TA to produce a list of accommodations common for students who have TS or TS plus? Many people don't know what to ask, and school typically does not offer up options.
Yeah, absolutely. So on these slides that you'll get, these accommodations that Patty suggested, the slides that I have are suggested accommodations. We also have a resource that's called Suggested Accommodations on our website. I will do a follow-up email with everybody who registered for the webinar, and I'm making a note right here to include that as a resource. So you'll have the slides and you'll have the resource in the slides because that's in the chat. And I'll also make sure that I include those suggested accommodations. And again, all these accommodations are suggested because every kid with Tourette is different, as we know. But I do know it's really helpful to have a list of possible accommodations to get your mind thinking of accommodations that you may not have otherwise thought of, but certainly ones that will fit for your child.
Next question is, sorry, it's moving. Okay. Can you have an FBA without having an IEP? Can you have one with just a 504 plan?
Yes, you can have an FBA without an IEP, and you can actually have an FBA with a 504 plan, and you can have an FBA without an IEP or a 504 plan. So any child can receive an FBA, a functional behavioral assessment.
Okay, the next question comes from Facebook. Do you have any tips for a college freshman whose vocal tics and anxiety have increased?
Yes, vocal tics and anxiety. Sorry, I have to make notes or I lose my train of thought. Thank you. So with vocal tics and anxiety increasing, I really suggest if the college student is entering college, if you haven't already, every college should have an office of a disability office. And I would suggest the student advocating and reaching out to the disability office. If college has started already, then do it now. If college hasn't started, do it before college starts. They will arrange to meet with you and talk about some accommodations. Some of those calming accommodations, a lot of college students with Tourette that we've heard from, we've had them make videos, and actually I can attach some of that when I send a follow-up email to everybody who's registered. But if someone's asking from Facebook, they may not be registered. We have a YouTube page on Tourette Association of America YouTube, and we do have some webinars and some videos from college students that talk about what has helped them. I do hear a lot about meditation and mindfulness and breathing being helpful. Meeting with the disability office at the college and letting them know that tics and anxiety have picked up. They can help you come up with a plan. We suggest letting college professors know. There's ways to do this, and if you do have the disability office in the know as well, they'll help suggest ways to reach out via email. They should know what's going on. I do know that there's college students that let their professors know that they need to get up and take a break sometimes and so that they know, the professors know why they might be coming in and out. And I think just making sure if they have roommates over at college, making sure that their roommates are also aware of their vocal tics and, you know, the potential anxiety. So I think for that in particular, like I said, our Tourette Association of America YouTube, there is even a search on that YouTube, and you can search college and you'll find some great tips. And also on our website, tourette.org, you can search college or starting college. And we really have some great resources about that. So thank you for asking. I hope I was a little bit helpful.
The next question comes from Marissa J. Are there any forms of FBA and BIA, or do I just mention it to the child's school principal, teachers, and counselors?
Yes, there's usually not a form right away for the family to fill out. If there is something that they want you to sign to, you know, to go ahead and do the observations and the interviews with the child, they will let you know. But you can actually reach out to, it's usually the school psychologist. You could let, if there's a special education teacher that works with your child, if you want to reach out and ask the principal or vice principal, they're not usually in charge of those, but they'll know, of course, who to send you to. You can reach out requesting for your child an FBA or a behavior intervention plan. And you could also, you know, reach out to us at the Tourette Association if anybody who's going to be doing those plans would like to talk to a school professional, another school professional, to understand Tourette syndrome and co-occurring conditions and what to look for when doing FBAs and BIPs. Reach out to us at support@tourette.org and ask if you could get some support at school, talking to or working with a school professional to do these plans.
Okay, the next question comes from Michelle E. What do you suggest for kids that have the throat clearing tic / coughing vocal tics? I know it's hard with getting screened every day at school, and then also with getting looks and comments from peers.
Absolutely. I would make it clear that for all the teachers especially, and the school nurse, that your child has Tourette syndrome and these are the tics that the child is experiencing now. We do have on our website, tourette.org, if you search TS card or Tourette syndrome card, we have one for coprolalia that you can print and they can be given out to let people know. We've always had those, and we also have hard copies of those. When COVID hit, we made a card that's just in the printable form. So you can print this card from www.tourette.org, search Tourette syndrome card, and it says, I have Tourette syndrome, and it explains symptoms of throat clearing, coughing, and sniffling as tics. And if you go to our website and you can't find that page, you can't find that card to print out, please reach out at support@tourette.org and let us know that you would like access to the card describing tics, such as coughing, sniffling, and throat clearing. But there might be something that the teachers or the student needs to say to the other students as well, or the child, you know, if the child's comfortable saying something about the tics, you know, whatever is appropriate for the situation. But definitely let them know, and let them know that it's, you know, common. Those are common tics with Tourette syndrome as well.
Okay, the next question comes from Robin H. My son is struggling with audible tics and noises. I understand the need to define plans with teachers, admin, how to handle, but what are some examples of the approaches that are taken to help reduce the distractions that it can cause in a classroom setting?
Sure. So it just depends. I mean, I was just working with a school and we were talking about, parameters around the ticks and reducing the distractions. So, certainly school professionals can understand or be, trained to understand or taught to understand about ticks and, the process of ignoring them as much as possible. But when the ticks do become, loud or distracting, to a point where they're, probably very distracting to the student who has the ticks, right? And then the teacher and then the other students. There are plans that can be put in place. It's not our first recommendation to send a child to another location. But certainly we have all learned that classes can have cameras in the room. And if a child's ticks are really interfering with their learning, I like to emphasize that more than with everybody else's. I know it can be a distraction to the teacher and the others, but I like to emphasize, for the child with Tourette, sometimes it's very distracting and it's easier for them to leave the room as well. And so certainly there could be another location set up that the student can go to so that they're not missing instruction and the classroom teacher has the camera on. I know I worked recently with a middle school and one of the teachers said, well, it took 5 minutes to set up the teams and set it all up. And I suggested if this is problematic, more or less on a regular basis, just have it set up before the student comes to class. So if the student does have to leave, that's a possibility. Some other options, before that would happen would be some of those if any of those kind of anxiety, self-regulation techniques would work, like the breathing, like if it would help to just take a quick break and come back. What's going to work for your child is going to be different than what's going to work for somebody else. But sometimes it's a matter of being able to stand. Sometimes it's a matter of being able to have a more comfortable place to sit. To drink water, a place where they're not noticed. Sometimes that can help reduce, and sometimes you tried all the things in the classroom and what I talked about, that alternative location can be put in place if that is something that that's necessary.
Okay, the next question comes from Julia M. My child has coprolalia and has just started middle school. How should I approach his teacher about it?
So with coprolalia, the school definitely needs to know. If it's middle school, I'm not sure. Some middle schools, some kids go to middle school with just one teacher, but most go with several. So whatever the case may be, the teachers need to know, but I will also say the administration and the other teachers in the school need to know. So I suggest making sure that everybody is aware of the ticks and ahead of time, and that I also suggest for coprolalia that the other students are aware of the ticks as well. And that can be done in different ways. There could be something that's sent to the students and the families. There could be a quick presentation for all the students, and you could reach out to us here at the Tourette Association to help put something together for that. I just know that if it's not addressed, it's very surprising to educators. And I will say, even when it's addressed, it still can be surprising to educators. Reach out to us at the Tourette Association. You can reach out. I am at wendy.wegman@tourette.org, or you can reach out to support@tourette.org, and I will get that request. When it comes to coprolalia, we are happy. I have a team of education advisory board members and education volunteers who are school professionals and either have Tourette or kids with Tourette. And we can all help the school to understand this. It's not something with coprolalia that you have to take on by yourself. So reach out and let us help you put a plan in place with making sure everybody at the school is aware of this, and your child can have the most successful and accepting year possible.
Okay. And the last question comes from Kim B. My daughter's school is not appropriately supporting her, even after I've explained her diagnosis. What other action can I take?
So sure, you can reach out to us here at the Tourette Association. Let us help you. I know often, even as a parent myself, and someone who's been a teacher for over 20 years, when it comes to my son at school, especially when you're in that sticky situation where the school isn't understanding, or maybe the school is somewhat understanding, but things just aren't going well, reach out to us. We can help. So we can help by being on a team meeting. We can help by doing a presentation. We can help by even just being on the phone with maybe it's a special education teacher, a school psychologist, a social worker, whoever works closely with the student. Maybe it's a teacher, maybe it's just a phone call or a Zoom call with the team. But reach out to us and let us help. I think that I want to say too, before I finish answering this question, I think it's on September 2nd. If you go to our website, tourette.org, and you look at attend an event, it's right on the main page. I believe it's September 2nd that I'm presenting resources that we have available to you for free. And I know oftentimes with this particular question that you've probably given resources and explained things, but I put that out there for everybody listening so that you can attend and access these resources. They're not just for the beginning of the year, they're throughout the year. And even for those that are having some difficulty, maybe getting people to understand, reach out to us for sure. And we can help. We have a team of people that can help with schools around the country. Also, some of the resources that you may not know of may be helpful to you as your child's personal advocate, which we are as parents of kids with Tourette and co-occurring conditions, and they may be helpful to educators as well. But for sure, if things aren't going well at school, at any point during the year, reach out to us and we can help.
Okay, thank you so much, Wendy.
You're welcome.
And thank you to all of our attendees for tuning in tonight. If we didn't get to your question during this Zoom meeting, we will be answering via email, so please look out for that email, either come from myself or Wendy. And just so you know, these programs are funded by the CDC, and we really encourage you to give your feedback. You will see in the chat that I've put out a couple of times the link to our survey. We always want to know how we can improve. And also if you have any ideas for any future programming that you'd like us to address. So everyone, please have a good night and stay safe.
Thank you so much, Amethyst. And thank you so much, everyone, for being on. Have a great night.
Bye.